Across the globe, countries are beginning to phase into what will be their new normal in response to the COVID-19 pandemic. Whether it's in an office, a warehouse, a gym, or a salon, extra precautions such as social distancing and symptom screenings can only go so far. Improving sanitation and environmental control is also key. Having a safe spaces program can help your company plan for the safe return of employees and customers as your business reopens. I have spent my entire career in infection prevention and control. For nearly 4 decades, I have been educating, consulting, and researching in how to prevent cross-transmission of infectious agents. For 24 years, I was the Associate Director of the statewide program for infection control and epidemiology at the University of North Carolina in Chapel Hill. I continue to be an adjunct clinical instructor in the Division of Infectious Disease there, but most recently, I've been the infection preventionist for the Centers for Medicare and Medicaid Services. The goal of this webinar is to provide a practical guide for creating a safe spaces in the office workplace. To do that, I will review protocols specific to COVID-19, limiting exposures, identifying risks, and listing preventive measures, including when and how to clean and disinfect surfaces, and to explore some new technology that can aid in environmental disinfection. A plan for COVID-19 prevention in an office setting involves 6 key measures. These include social distancing, providing for appropriate hand hygiene with alcohol-based hand rubs readily available at each desk or workstation. And here, messaging is important. Encouragement to follow respiratory hygiene and cough etiquette is a requirement for mandatory use of either disposable or reusable face masks to always be worn. Why? A mask disrupts the trajectory of a cough or sneeze and captures some respiratory droplets before they can spew out. A mask can also prevent large droplets from landing on the nose and mouth, even though it provides minimal protection from small droplets. I think this pandemic is going to change the way people perceive and value cleanliness. Environmental cleaning and disinfection or sanitizing will be seen as a basic safety precaution. I see routine disinfection or sanitizing services being added onto the janitorial services. Finally, there are environmental controls that include disinfecting equipment and increasing ventilation. So we have learned that COVID-19 is a highly infectious respiratory illness with a high mortality rate that can spread between people who are in close contact. Close contact has been defined as 6 feet. Why 6 feet? Because that's how far respiratory droplets produced when an infected person is breathing or talking can travel. However, we now know that without a mask, droplets produced during a cough can travel up to 20 feet, and from a sneeze far further up to 26 feet. It's not just coughing and sneezing that is a concern. Studies have shown for influenza that infected people with mild or no symptoms may also generate infectious droplets through speaking and breathing alone. With COVID-19, somewhere in the range of 15 to 25% of infected individuals will remain totally asymptomatic. An asymptomatic infected person talking for 5 minutes in a poorly ventilated space, like commercial office space, can produce as many droplets as one infectious cough. The droplets in a typical air exchange rate found in offices may stay aerosolized for 20 minutes or more, depending on the air exchange rate. Importantly, individuals who may be mildly symptomatic or asymptomatic are still highly infectious. The other way to become infected is by touching a surface or an object that has the virus on it, and then touching your own mouth, nose, or eyes. We have just reviewed why social distancing is so important. If a customer can reach out and touch someone from their workstation, then that workstation place isn't set up for social distancing. Social distancing is the least reliable control measure because it relies on each individual's compliance to stay minimally 6 feet apart and to always be wearing a mask correctly. Over the last decade, office planners and big employers have shifted to more open environments, with workers sitting cheek to jowl in close quarters. Average workplace densities in many offices are twice what they were a decade or two ago. Private offices and even ubiquitous cubicles have been replaced by more open shared environments. So how's that working in the age of COVID-19? Not well. As we have just discussed how far respiratory droplets can travel and stay hanging in the air, what is the biggest problem seen here? Even though every other desk may be unoccupied, a single cough or sneeze would contaminate more than a dozen people because of the low barriers. If a standing 6 foot tall person can see eye to eye contact with another person in any direction, then that's an issue for cross contamination. What then are some solutions to these problems of social distancing? So the correct workplace model using open room plan with work cubicles is not conducive to social distancing. As we reopen in the interim period, one could achieve social distancing by a phased return, occupying fewer desks within the same office. However, square footage is expensive and not utilizing space effectively is a concern. In the longer term, we will need to rethink the design of workplaces entirely. Strategizing about how to accommodate customers and guard against infection now should include CDC recommendations designed for workplace settings, such as by utilizing portable walls or privacy panels to enclose open areas around individual workstations and having individual workstations facing out or providing more spaces between individual workspaces. The goal is preventing or minimizing face-to-face exposure time, which could also include scheduling time for use of communal areas like restrooms. Respiratory etiquette and hand hygiene is one of the most important things every person can do to prevent cross-transmission of any respiratory pathogen. To accomplish respiratory etiquette and hand hygiene, people need supplies and reminders. It's best to have these supplies at the office entrances, in a conference room, and strategic locations. The items that should be available include alcohol-based hand rubs. Be sure that the products have between 60 and 95% alcohol content. Mask, either disposable or the cloth mask worn in by the clients themselves, are okay. Tissues and a receptacle are also important to have for disposal. Along with respiratory hygiene and cough etiquette is posting signage to explain expectations and encourage hand hygiene, covering coughs in the bend of the elbow, wearing a mask, and not entering if feeling ill can help stop the spread. These informational reminders should be placed at the entrance to your workplace and other areas where they're likely to be seen. Studies have demonstrated compliance is significantly improved with posters placed as reminders. There are many posters available from the CDC, so rotating or using a variety of posters can also improve compliance. One of the most frequently asked questions I've received is how long can COVID-19 survive on surfaces? I have heard TV subject matter experts give a wide range of answers from hours to days. That, as they have said, was based on other coronaviruses. But a recent study in the New England Journal of Medicine found that viruses like COVID-19 can survive on hard surfaces such as plastic and stainless steel for up to 72 hours and on cardboard for up to 24 hours. Study authors were supported by the National Institutes of Health and the U.S. Department of Defense. What's really important here is the infectious dose. The infectious dose is key to cross transmission. In SARS, we recognize super spreaders linked to aerosol transmission through ventilation and fomites on contaminated surfaces, as opposed to being directly exposed to people, also played a big role in transmission. In COVID, transmission of environmental survival lends itself to being as long as the SARS-CoV-1 and adds credence to the hypothesis that it too may be associated with super spreaders. For those reasons, we really need to ensure that environmental cleaning and disinfecting procedures are followed consistently and correctly. Routinely cleaning and disinfecting all frequently touched surfaces such as workstations, countertops, handrails, and doorknobs, and that might need to be done daily, every 2 hours, or even after each use. Provide disposable wipes in common use areas so that individuals can clean their desk chairs, work tools, and other equipment right down between each use if so chosen. The good news is COVID-19 is very sensitive to cleaning and disinfecting products. There are many common healthcare grade products like quaternary ammonium compounds or phenolics that are on the EPA N list that all work effectively on COVID-19. I have included the link to the EPA list at the bottom of the slide. You can check the EPA registration number to determine if it's on the approved list or if it has a label claim against coronavirus. Second, having protocols for the products used is critical because contact times for the disinfectants vary from 1 minute to 10 minutes. It's very important to follow the manufacturer's instructions for use in order to be effective. There are also a number of household products that have been shown to be effective against COVID-19. This is important as many regions are experiencing shortage of EPA products and will continue to do so for some time. The household products that have been shown to be effective against COVID-19 include 3% hydrogen peroxide, dilute household bleach, and the CDC recommends mixing 4 teaspoons per quart or 1/3 per gallon, made fresh daily. 70% rubbing alcohol is also effective, as is Lysol sprays. All these products have 1 minute contact times, the surface wetted and then left to dry. You don't want to wipe off the disinfecting products when they're wet like you do dusting because they won't have time to effectively kill the virus. If surfaces are visibly dirty, the surface should be pre-cleaned before the disinfectant is applied. Disinfectants just can't work through organic material. For example, if a client leaves a desk with a greasy film or spillage from drinks or food, the surface needs to be cleaned first and then disinfected. Next is a rather nuanced issue, but even how we clean in the era of COVID-19 can have liability issues. Shown here on the right is an electrostatic sprayer. OSHA released the interim guidance for businesses and employers to plan and respond to COVID-19 that includes guidance on what type of equipment is used for dispersing, cleaning, and disinfecting agents. I'm seeing a lot of companies not invest in electrostatic sprayers because of the cost and opt instead for pump sprayers. The issue here is that OSHA is stating pump sprayers shouldn't be used because they can aerosolize the virus, essentially making it airborne again, making the risk of cross-transmission actually worse. Other recommendations from OSHA's guidance on preparing workplaces for COVID-19 involve engineering controls. Preparing engineering controls in isolating employees, or in this case, clients or customers, from work-related hazards. In workplaces where they are appropriate, these types of controls can reduce exposure to hazards without relying on worker behavior or client behavior and can be the most effective, cost-effective solution to implement. Engineering controls for SARS-CoV include increasing ventilation rates in the work environment. The average air exchange rate in offices is about 2 air exchanges per hour, which is very, very low. And it's not easy to change a building's air exchange rate. However, improving air quality and decreasing viral load can also be done by installing high-efficiency air filters. While hospitals do this routinely, it's not something you can really do in a commercial space. But what can be done is you can add portable HEPA units, which can both increase the air exchange rate and significantly increase the filtering ability for bacteria and viruses. When purchasing a portable air purifier for sale, it's important to buy one that is the right size for your needs, depending on the size of your room. Most high-quality portable units sell for between $200 to $1,000, depending on the extra bells and whistles that you want to add. Another engineering control is using portable, freestanding UV light disinfection units that provide a rapid and highly effective method to disinfect room surfaces and common touch points to reduce the transfer of these dangerous organisms such as coronavirus. Some units can achieve a 99% reduction of all bacteria and viruses in 1 minute within a distance of 10 feet, making it ideal for decontamination of all your company's shared spaces, including lobbies, conference rooms, kitchenettes, restrooms, and cubicles. Measures for protecting individuals in an office setting from exposure to COVID-19 depends on the potential for interaction with people and the contamination of the work environment. Rethinking office spaces to becoming a safe space involves many factors. Upon entering the building, the doors may open automatically so you don't have to touch handles. Before you board the elevator, you might tell the elevator where you'd like to go rather than pressing the many buttons within the elevator. When you rethink office spaces, you should walk into a room that is with directional flow, dividers, and well-spaced desks instead of the crowded open floor plan that we're all used to. In common areas like meeting rooms and kitchens, you should expect to see fewer chairs and posted documentation the last time they were cleaned. These are just the changes you will be able to see easily. Less noticeable in the post-coronavirus office should be more frequent cleaning policies, amped up ventilation systems, and even the addition of UV lights for more deeply disinfecting the office at night. All these protocols and practices should be in a plan that will make for a safe spaces program.